This is Dr. Shamini Bodhi, a consultant gynecologist in the Grand Bahama Health Services. This month, we are taking the time to recognize pregnancy and infant loss awareness. Often, pregnancy and infant loss is something that goes overlooked and unacknowledged. And losing a child is perhaps a parents-to-be worst nightmare. We know that this is a challenging position for many families that may have empty arms and hearts that are filled with grief over their little ones that are lost before time. And October is a month that we recognize this. And families may experience miscarriage, stillbirth, and the death of an infant. This topic is emotionally difficult to discuss, and many times conversations may go unheard. We know that a miscarriage is a pregnancy loss that occurs prior to the 20-week mark. And we know that 10 to 25% of pregnancies may be lost in the first trimester because of miscarriages that may be linked to age, issues with the womb, infections, and lifestyle habits such as drugs and alcohol. And others may be lost for causes unknown. Some pregnancies may not implant in the uterus in a normal way or may not have sufficient support from the body. Some ladies may never even realize that they've miscarried. Others could have signs of bleeding and cramping as their body attempts to empty the uterus. If you suspect that you or a loved one is having or has had a miscarriage, it is important to discuss this with your healthcare providers. And it's also important to know that just because you have one miscarriage, it doesn't mean that you will have another one. We need to continue to try to break the silence in our community as we understand the bond that mothers form with their children while in the womb. Patience, support, and empathy is important. Losing a pregnancy or a child may change you forever. So let us continue to bring awareness to this difficult topic and continue to support those that have encountered pregnancy or infant loss.